That's a good question. And this may not be the answer everybody wants to hear, but hand hygiene is actually what we should be doing all the time, not just when we have COVID-19 in the area. If everyone washes their hands after they sneeze or cough or touch outside surfaces that may be contaminated, a lot fewer people would get sick during the cold and flu season and during the COVID-19 epidemic that we're in. No, not really. The severity of the virus in an individual is more closely related with how their immune system responds to the virus and whether they have underlying medical conditions that may put them at greater risk. That's a great question and one we get all the time. Talking more specifically about the COVID-19, symptoms really do range all over the place. As you know, a lot of people don't have any symptoms at all. Some people will develop a cold or a cough or start to have fevers. If you're starting to feel sick and you have concerns, a lot of physicians' offices, including my own, are doing video visits. And we can actually look at the patient, talk to them through a video visit and determine whether they need further testing or whether they should go to the emergency room for further evaluation. Yeah, that's one that if somebody has respiratory issues that are underlying and they've got a bad cough and they feel like they're short of breath, they do need to be seen. They should call their physician. They should discuss with them what their symptoms are and then determine the best plan, whether that physician's network has a respiratory center they can go to get tested and get an x-ray, or whether they need to just go to the emergency room for further evaluation. I don't know if anyone really knows. You have to be evaluated by your physician or by your healthcare worker, and I think it's going to be individualized for each person. Many people have very mild symptoms and they don't have to do very much with that. Other people have more severe symptoms and there'll be another set of recommendations based on health history and what their severity of their symptoms is. As we're seeing more people get through this virus, we're getting more phone calls about, when can I go back to work or when can I start interacting with people again? The CDC is recommending that 3 different conditions be met. One is that you don't have any fever for at least 3 full days. So on day 4 of no fever, that meets one of the requirements. The other thing is you should have improved symptoms. So for example, if you had a bad cough, your cough should be substantially improved by that 4th day. And at least 7 days should have passed since your symptoms had first appeared. Most folks are going to have symptoms of this anywhere from 8 days to 14 days. So that one is guaranteed you're going to meet. But the other ones are the important ones. You really should be symptom-free for at least 3 full days prior to considering yourself not contagious, with your symptoms decreasing in severity. Flu season lasts from October through May. So we're looking at, 7 or 8 months of time where flu is circulating in the community. So during that time of those 7 or 8 months, we had 34,000 deaths. So far, over the last couple months in the United States, we've had 50,000 deaths from COVID-19. So that puts a big strain on the healthcare system. The other reason that we're worried about supply shortages now is just because of that. So many more people are being hospitalized and so many more people are dying in a shortened amount of time. We're going through our supplies much faster than we would in a normal flu season, where we're spreading it out over, 6 or 7 months. Another difference between the two is that, we have a vaccine for the flu. So all the measures we've taken to practice social distancing and stay at home are intended to really help with this, flattening the curve and preventing a huge surge of patients into the hospitals to the point where they can't care for people and it strains our resources. Yeah, I think that there probably will be. They're talking about this some on these briefings that they have. And we expect to see rising cases in the fall that kind of coincide with the flu season. And probably hotspots will be popping up in different places through the year, even past that. lot of us in medicine are on the front lines dealing with this, and a lot of people don't take the social distancing very seriously. But everybody in medicine now has had patients affected by this, either through family members getting sick and seriously ill, or patients who have died, or patients' family members who have died. So I can't stress enough how important it is to stay away from groups, to practice good hand hygiene, and to practice this social separation. I think that's the only way that we can get through this to the time that we actually have a vaccine and hopefully a better treatment for when people get sick with this virus.